death is scary. And so therefore thinking about hospice, which is so closely affiliated with death, is also a scary thing. And hospice is a beautiful thing. And so if you've got someone that you are thinking about, maybe hospice is bouncing around in your mind, know that it is a gift that you would be giving to them. And if you're a patient, it's a gift for your family.
What if everything you thought you knew about end of life was wrong? What if hospice isn't about giving up, but about truly living? Join us on Our Hospice podcast, Making Every Moment Count, where we explore hospice care and why it's truly a gift. Welcome to Our Hospice podcast, learning to make every moment count when it matters most. We're here to share honest conversations about what matters most in life, caregiving, and end-of-life care, with real stories that matter to you. Whether you're a patient, loved one, or healthcare professional, maybe you're simply curious about hospice. This is the space to connect and learn how to make every moment count. Hey folks, welcome to Better Together, our hospice podcast, dedicated to sharing the true nature of hospice care. And we're going to debunk myths that often surround it. So today we have a special guest, our medical director, Dr. Leigh Anderson.
Hi, everybody.
Hey, Dr. Anderson. So glad you joined us. This is a topic that's so close to, our community, our hearts, all of your listeners, hospice care. And so before we jump in, and can you tell us a little bit about your background and how you came to Our Hospice?
Yeah, definitely. So I went through medical school here in Indianapolis. I did internal medicine residency in Indy during the pandemic. And then after that, I did an additional year of fellowship training in hospice and palliative medicine, also in Indiana. And then after graduation or completing my medical training, I wanted to find full-time work in hospice specifically. And so I found Our Hospice here in Columbus. And it was my dream job. It still is my dream job. It's, we're a non-for-profit organization, not too big, not too small. This, has wonderful quality care, very mission-driven, and, every person that works here is just so kind, so intelligent, so patient-centered. And I couldn't be happier. So that's how I came to find Our Hospice and be here now.
Well, you have a lot of responsibility here. You lead and we use a big word, interdisciplinary team. And so I wonder if you can just talk a little bit about that as a leader of all the clinical care that happens here, who those folks are.
Yeah. So oftentimes, and the listeners, you guys might notice this too, but healthcare, as it gets more and more advanced, easily can become quite siloed. And I think a beautiful part of hospice is that we treat the whole person. So not only are we managing, all of your symptoms, the physical things that a patient needs, but also recognizing that there's a spiritual aspect to every person, a social aspect to every person. And so not only do we have physicians, nurses, nurse practitioners, we also have social workers, chaplains, volunteers, therapy dogs, you name it. We've got a whole group of people that come around you and support you, when you're a hospice patient or a family of a hospice patient.
Mm-hmm. So true. So, we have at our hospice of South Central Indiana, 22 counties that we serve. And, in South Central Indiana, a lot of the underserved, under-resourced areas that our folks go to. And you oversee all of that care. And so we're grateful to have you here today. Let's go ahead and talk a little bit about, one of the biggest misconceptions, I think, around hospice is, when they hear the H word, the hospice word, they think it's about giving up. It's about giving up hope. Mm-hmm. And so can you just address that? What are some of the other ways to think about hospice and really what it is?
Yeah, so I do hear that, quite a bit. Well, I don't want to give up. And to me, that's a trigger for me to kind of dig a little bit deeper. I always like to ask, what are you hoping for? What are you worried about? So when someone says giving up, I say, well, what worries you? About stopping treatment or, changing over to hospice. And it honestly can really vary from person to person. Sometimes it's, well, I worry I'm going to be in pain. My doctor's giving me, XYZ and I don't want to be in pain. And then that kind of pivots the conversation to we can talk about, well, how can hospice help you, with your pain? We're great at that. We have access to medicines maybe your primary care doctor doesn't have access to, those kinds of things. Sometimes it's, well, what are you hoping for? Well, I'm hoping to live as long as I can. People are worried that their time on earth is going to be cut shorter, if they go on hospice. And that actually opens the door to talk about how, well, actually, hospice helps patients so much just with symptoms and quality of life that patients really tend to live longer once they enroll in hospice.
Yeah, I think our average length of stay is at 92 days right now. So, that's just average, and many of our patients live much longer.
Yeah. Oh, yeah. I mean, a typical example, one I see all the time, even I had a patient this week, but heart failure patients fill up with fluid, their legs get puffy, they get short of breath because there's fluid in their lungs, and they're going to the hospital once a month, to try to get this fluid off. Well, when a nurse, comes in a couple of times a week and is in close communication with a physician and medications get adjusted, diuretics get adjusted, they feel better than ever. They are having no trouble breathing. We had a patient this week who was stuck in his room because his legs were so swollen and painful. And now by the end of this week, he's going to the dining room 3 times a day, for meals, and is really happy that he's more mobile. So like patients like that, it's once they get the right level of care, the care that they need, they do so much better.
One of the things that our team is doing a really good job every single day when we talk about our mission to make every moment count is they ask the patients, what matters most to you today? And if it's about, I want to go to the dining room and see my friends. Maybe they live in, an extended care facility or an independent living sometimes, and hospice comes in and, has another layer of support. There's an example right there.
Yeah.
What about for the caregiver, the family members, about the giving up, sort of debunking a myth? If we elect hospice, are we as a family giving up on them? Sometimes, the patient will have their own, concerns, but they're ready often. And I'll see caregivers that feel guilty, if they enlist hospice. And what are some of the things you see or conversations you have?
Yeah. So, so often with families, especially because so many disease processes take so much time, that this role of caregiving or I've got to do X, Y, and Z, I got to bring him to these appointments, it almost gets baked into an identity. And it's a hard transition for families to kind of pivot away from that too. A lot of times I try to reframe, instead of like, well, I don't want to give up on dad, or, I just kind of turn the conversation a little bit to, if dad's got dementia, for example, well, hey, if, your dad could talk to us right now, if he could really tell us, what would he think about all of this? What, or I might go back a step further, like, tell me about your dad. And a lot of times I hear, well, dad is fiercely independent. Dad loves doing, working on the farm. Dad, this. And so then once we've kind of talked about dad and I get a sense of who dad is, then I can kind of ask the next question of, well, if he were able to talk to us, what are dad's thoughts about going to the hospital, again and again, or, would dad rather do that, or would, and it almost makes it easier for families to see things from their loved one's perspective.
This is a really important thing you're saying. I mean, listeners, do you hear this? Because I have a family member, I think, that is struggling in this particular area, right? It can become an identity. It can happen to any of us.
Yep.
As a parent, as a child, your identity is delivering the care. And as someone else takes over that, what does that mean for you?
Yep.
Really good stuff. If there were some strategies for our listeners, maybe for the caregiver group or family members, that they could, maybe just one thing that they could do to help maybe shift their mindset, in support of, the care team that could wrap around their loved one, what would you encourage them to do?
As far how to shift their mindset, I would just always kind of take it from the perspective of, if my loved one were here, what would they say? What would their opinion be? And sometimes it's a hard thing to wrap your head around. Maybe they want to be comfortable. Maybe they want to be at home. And those can be hard things, because what do you mean you want to be home and I'm not supposed to take you to the emergency department?
Yeah.
What do you mean? Okay, we're talking the H word, we're talking hospice.
Yes.
Okay, what do you mean? There's some medicines, are scary to people, and reasonably so. We use morphine, and that's scary for families. But under hospice supervision, so safe, so effective. What does it mean? I gotta try it. We're gonna try a little dose of morphine to see if it helps dad's breathing or help dad's pain. So I would it's a scary thing to do and it's a brave thing to do.
So good. What if we shift gears for a minute and we talk about sometimes there are folks that want hospice and maybe they don't qualify yet. And what does that look like? What does qualify mean and who qualifies them?
Yep. So qualifying for hospice. So the kind of just standard definition is that if a patient has a prognosis or a life expectancy of 6 months or less, then they would be appropriate for hospice. And that doesn't mean that patients are going to live only 6 months. No one knows that for sure. It could be you live years. We've got patients that stay on service for years.
How does a physician decide that?
A lot of different things. It's two physicians, that'll say, I write a little essay. So I look through, a patient's medical record, their chart. I dig in based on what the main disease process is. If it's dementia, if it's cancer, if it's a lung disease or a heart disease, there's certain indicators I look for. Maybe it's a lab value, maybe it's an ultrasound result or a CT scan, if cancer is metastatic or not. We also lean heavily on functional status. So is this person able to get out of bed? Are they mowing their yard or are they bedbound? Are they brushing their own teeth or does someone need to help them, with that and make their own meals? And so we'll look at functional status, imaging, lab results, notes from doctors, all of the above to kind of paint an overall picture of someone's prognosis.
Good, so good. When a person qualifies for hospice, there are a number of things that are, would say covered under their insurance benefit. If they're probably the largest payer for hospice is Medicare, and I want to say about 95% of our patients have Medicare, and maybe the other 5 has commercial payers insurance. But what are, some of the things that are covered under their Medicare benefit when they elect hospice? Are there vacations and what else?
Oh gosh, this is another beautiful thing about hospice is pretty much everything is covered. So if we call it durable medical equipment, which is just things like a shower chair, a bedside commode, a hospital bed. Gosh, it's hard for patients to get in and out of bed. We can get a hospital bed, so we can adjust things. We've got side rails so people aren't falling.
And I don't know if families realize that, it's not their expense.
Yep. The medical equipment, you're not trying to find something on Amazon. We've got it for you already. Medications, anything medication related, we cover all of that. Other things that we cover, like all of the visits, all of the team and the staff that we have that are coming to your home and providing visits. We also have a hospice house that we provide. And we'll talk about that more later, I'm sure, but just place for someone to come and stay if symptoms are uncontrolled or a family needs a break for a short while. So yeah, everything actually kind of stays under the hospice medical benefit.
It's such a good I think this is a good time. I'm thinking about the hospice center, the hospice house, we're really, we're so lucky to have a hospice house and blessed to have that here at our hospice in Columbus, Indiana. It's a 14-bed inpatient unit, and not all hospices have one because it is financially supported really with philanthropy and the community. So what are some of the things we do at the hospice center?
Yeah, no, I would love to talk about the hospice center. You're exactly right. It is rare for a hospice to have a hospice center, a hospice house. There's only, I feel like I can count them all on one hand, the number of hospice centers we have in the state of Indiana. So for us to have one, it's huge. We actually have a YouTube video that's a tour, a virtual tour. So we'll include that in the notes.
Show notes? Okay.
Because I think it'd be great for you guys to kind of take a look at it. It's so homey. It's so comfortable. And you were asking what we do with the hospice center. Yeah. So it's open for all of our hospice patients. Most commonly, we see it used for, we call it respite. So let's say, you're caring for mom and, but you've got a trip to Florida coming up and it'd be maybe too hard on mom to drive down to Florida or to take a flight down to Florida. So you can leave mom with us. You go to Florida, for a week. We've got mom covered. Like nursing care all around the clock, home health, the whole thing. She's with us. She's safe. She's comfortable. And then when you come back, you bring her right home with you. Or sometimes it's just you need a break.
Right.
It's hard to be a caregiver. And so we've got plenty of families who once a month, they say, hey, okay, mom, or hey, okay, dad, time to go to the hospice house, for your 5 days. And they love it. They
I
have
feel
a
like
ton
the
of fun.
first time is hard, and almost like, the first drop off, and they realize how much, the team loves on them, and they have a
Yes.
great time. And
Yes.
we also have volunteers and companionship and activities, and
Oh, yeah.
so there's a lot of wonderful things.
Yep.
And so then it does get scheduled. It starts to get
Yeah, because people are like, oh, yeah, this is
this
really
is good.
nice.
Okay.
The other thing we do a lot too is if, gosh, you're at home, we come to the home, we spend, we're there at 2 a.m. if you need us. We don't live with you. We're not there 24/7, but we're available 24/7. If something happens, there's a fall, maybe an injury, pain isn't good because we just had this fall. Well, hey, come on in to the hospice house. You as a family get a break, relax, stay home, get some sleep, catch up, do what you need to do. We've got them, I'll adjust. And then we have, a physician that rounds 5 days a week. We've got a nurse practitioner that rounds on the weekends. So you're seen by a provider every single day. And we're going to adjust your medicines once a day, maybe twice a day. We're aggressive with how we change things because we want to get you comfortable as soon as we can. It's not, oh, let's try something in a week later. It's every day we're making a change to get you comfortable as quick as we can. And then once you're comfortable, symptoms are controlled, then we can send you back home.
So that would be, we talk about GIP or general inpatient, almost like a mini hospital opportunity if, symptoms for some reason were out of control, like you were talking about a fall or something, or something changed, a symptom changed, and we could bring in your loved one and yeah.
Definitely. I mean, we tell our hospice patients that if you have an urge to call 911, call the hospice. Hospice is your new 911 because we can provide an ambulance. We can bring you into our quote unquote hospital. It's our, hospice house that is much more comfortable, much more comfort oriented, and it's the best place for people.
So good. This has been a great conversation. We're with Dr. Leigh Anderson, our medical director for Our Hospice of South Central Indiana. So really great stuff. If we were to talk about maybe a takeaway that we could give our listeners here, if maybe they have a friend or maybe they have a neighbor that is wondering about hospice for, their loved one, maybe it's, what would you tell them? How can they find us? What would you tell them or encourage them to do?
So I guess I'll tell them the takeaway maybe first and then how to find us second. So my takeaway would be, death is scary. And so therefore thinking about hospice, which is so closely affiliated with death, is also a scary thing. And hospice is a beautiful thing. And so if you've got someone that you are thinking about, maybe hospice is bouncing around in your mind, know that it is a gift that you would be giving to them. And if you're a patient, it's a gift for your family. So that's my hope. That's my takeaway, for the listeners for this podcast. And then as far as how to find us, we've got.
Yeah.
Oh, Steph, you want to let them know?
Yeah, sure. I also want to thank you, for everyone for listening to our hospice podcast. But really, Dr. Anderson, you helped us understand the gift of hospice care. You did. This is just a really great, I think, real conversation today.
Good.
And hopefully we'll continue with more questions that folks send in. And but yeah, if you want to learn more about our hospice and our services, you can visit our website at ourhospice.org. You can call us directly, and we'll help coordinate all the pieces to come and visit with you and your loved one. It's 812-314-8083. Again, 812-314-8083. Join us next time as we continue to talk about meaningful conversations about life's final journey. Until then, hey, remember, we are better together, and we're here to make every single moment count. If you have questions or want to learn more about our hospice and the services we offer, please visit our website, ourhospice.org. That's O-U-R hospice.org, or call us at 812-314-8083. Join us next time as we continue to explore meaningful conversations about life's final journey. And until then, remember, we are better together.